call upon Meenu Chaudhary. She will speak on high order aberration and keratoconus. Meenu.
Thank you, ma'am. I think I would like to thank the All India Ophthalmological Society and the local organizing team for calling us and letting us do this Nepal Ophthalmic Society session. So this topic, high order aberrations and keratoconus, is something which is not talked about much, and it is very important because it is actually affecting the visual quality of the patients who suffer from keratoconus. So first we should understand is what is this high order aberration. Actually, the human eye is not a perfect optical system, but it suffers from high order aberrations that degrade the retinal image quality. So light aberration is actually causing blurred vision. So there is this diagram which shows that if the surface of the cornea is not normal, or if it's thinned out, or if there is some problem, then it doesn't go and converge in one point. So it forms a blurred circle. So these aberrations are actually when the light from one point of an object does not converge or diverge into a single point after transmission through the system, and it forms that blurred circle. So if you see the classification, optical aberrations can be monochromatic or chromatic aberrations, but nowadays we don't follow the Siddle's classification. We normally follow the Zernike's classification, which also again divides the aberrations into low order and high order aberrations. And we are basically, like, even if you have myopia or hyperopia or even astigmatism also, you will have some kind of low order aberrations, but that does not really cause so much of problem because we can actually correct it with spectacle lenses. But high order aberrations in the form of spherical aberrations, coma aberrations, and other high order astigmatisms are again very important. So normally we follow this Zernike's polynomials, where you see that the first order are the ones which are in the higher side, which is basically the aberration caused by astigmatism. But then if you go to higher order aberration, which is on third, fourth, and the fifth line, where you have the coma, which is the vertical coma, and the horizontal coma, the trefoil, the quadrifoil, and the spherical aberrations, which are very important. And these spherical aberrations are actually depicted as point spread functions, which you see when you do an aberration. And I don't think I'll go much into detail. So this is again also a slide showing the point spread function, like when the light moves from the corneal surface. So actually these aberrations are a function of the corneal surface or the corneal topography, not something that is going on inside. And then it forms an image where it can be in the form of coma, the trefoil, or the spherical aberration, and you can see that as a blurred image. So this is how the image degradation happens when you have the aberrations. And how are these aberrations actually measured? They are measured with the help of aberrometers, and you have a commonly used technique, or the method is the Shack-Hartman method, where in which a bright light of beam is projected into the retina and then it gets reflected back through the eye. So this is just a photograph showing the Hartman-Shack aberrometer. And I think now what are these symptoms of high order aberration? Because in keratoconus now this is very important, and because keratoconus is actually by the children, so they don't actually know what is happening. So they may complain of glare, blurring, double vision, lack of contrast, reduced color perception, starbursts, halos, and even decreased distance and near vision. But you should also take into account the pupil size. The size of the pupil is also going to cause some amount of aberrations. So keratoconus, like we all know, it is a progressive disease which may affect one or the other eye later on, and there is corneal thinning and protrusion, and that leads to reduction in the optical quality of the eye because of the corneal distortion, the scarring, and high order aberrations. And like what I'm saying, actually the high order aberration is not the function of the retina, or the post-retinal neural aspects are all fine. It's just the corneal surface which is causing all the problems. So we all know by the time in our countries the patients come to us, they have Vaux dry, or they will have monsoon sign, or the cornea is very thin because of the thinning of the cornea leading to the cone. You may have patients where they have scars. But it is very important that you actually pick up these keratoconus patients in the early stage when they're complaining, or you have to go for these topographies, which is now mandatory, at least for patients who are coming with inflammatory diseases, VKC, or even people who have predispositions, especially in the siblings, you should do that. So the keratoconus patients will come with coma, in which they will complain of double vision. They may have trefoil, where when they say, how does an image look, it looks something like how the Mercedes-Benz Swimble looks like. I'll show you the photographs. And spherical aberrations, if they have spherical aberrations on aberometry, they may complain of halos, starbursts, ghost images, or lack of contrast sensitivity. So now it's very important to see for all this. See, this is how a ghost image actually looks like. So when the patient comes to you, you have to ask them, do they see another second image or a ghost image next to the normal image? See, when you see, it's not clear. So this is how your child or the keratoconus patient is actually seeing. See, this is how now you have an halo. When you see the car lights, especially if they're driving, in our countries also, even the children start driving. So it's very important to ask them to see whether they see the lights like that. This is a very important, these photographs are very important for how they may see things. So now these are cases, I'll show you some of the cases where, like when you have a keratoconus, you have a cone which is dropping down. So once the cone is going more inferior and more inferior temporally, you start developing a coma. So when you have this high order aberration in the form of coma, now they will have these symptoms of high order, like I said, double images, glare, halos. So it's very important to do a topography, and you have to do an aberometer. So when you do these aberrations, you can see the low order aberration is about 3.45 and the high order aberration is 3.39. So I don't have a pointer. Do you have a pointer? So you can see that actually in the second row, if you see, the second picture, that is a vertical coma, which is about 2.81. So that is quite high. So as your thinning and the cone is moving down, you develop more of coma. So these are again some of the photographs. See where you see that the low order aberration and the high order aberration is, the high order aberration is, it's not coming. So the high order aberration is nearly 8.53. So as your cone and your cornea is thinning down, your surface is becoming more, curvature is increasing, it's becoming more steep. See, the more the high order aberration is increasing, and that also leads to increase in the spherical aberration. So these are the photographs of cases where you have the topography, where you can see that there is the cone. So this is the cone, this is the posterior elevation. So now this is a photograph. See, it's very important that whenever you have a patient or you suspect a keratoconus case, please do a topography and please do an aberometry map. See, look at these images, how they see. The high order aberrations are increasing. And as the high order aberration are increasing, if you see the graph on that side, which is red, you see that the reference green color is decreased, and the white and the red color is increasing, because that shows that the steepness or the curvature is increasing and the high order aberration is increasing. So this is again a case 2 where again your cone, the posterior elevation is increased. And as see again here, look at the image. The image, that is how the point spread function, that is how the high order aberration is increasing and how the patient actually looks at. There is no green, if you see the map on that side, there is no green color actually. It's all black. So that shows that the surface is so aberrated, or it is so, like there is so much of problem with the surface. See now this is again this case 3. Same thing, the topography, you have a big cone there which has shifted infero-temporally. So how do you actually correct these things? They don't actually get corrected with spectacles. You have to go for adaptive or customized lenses. Even normal lenses, contact lenses don't work. You can go for RGPs. But the best thing is to use the customized or the adaptive lenses. So this is, like I said, it's with these adaptive lenses. And I think I'll show this last picture. This is one of our case. See, if you see, the high order aberration is so high that the point spread function, there is no green color as the reference color on the slide on that side, and you only have the black color. So this was corrected with scleral contact lenses. See now, at least the blue color has come, the green color has come, and the high order aberration has decreased to minus 1.91, whereas initially it was 29.90 if you see above. So it's very important that you correct and see the visual quality of the patient is very important. Otherwise, his school performance, or most of the times initially I remember, they used to be diagnosed as amblyopia because that time we didn't have topography, we didn't have aberrometries. So it's very important that we diagnose, and many times the children will not complain. So we have to ask them, do you have these problems? And these maps are very important. So in conclusion, I would like to say that keratoconus patients suffer from high order aberration. It affects their vision and their quality of life. And it is actually a surface problem or surface irregularity. So corneal topography and aberrometry can help in early detection of keratoconus. And the treatment is with contact lenses, but the best is customized or adaptive lenses, which are still lacking. But still, we can try with these scleral contact lenses. Thank you all, and I would, as President of Nepal Ophthalmic Society, I would like to call you all for our annual conference, which will be held this year in November 22nd and 23rd. So please come, we welcome you all for our annual conference. Thank you so much.
Thank you, Meenu, for your excellent